Hey, everybody. Welcome to Meddkit's Provider Spotlight, where we are interviewing the most amazing private practices from all over the United States. Every week is someone new, a different perspective, different specialty. And today we have a really awesome special guest, Dr. David Alpan, owner of Alpan Orthodontics in Los Angeles. Welcome. Thanks so much. Appreciate you coming
Thank
on.
you. I'm glad to
Yeah.
be here.
Yeah, we're excited to kind of dive in here and looking forward to hearing your story. So I think we'll start with that. Tell us, what inspired you to open up your own practice?
Well, my father was a dentist and my grandfather was a dentist. So I kind of grew up with already having some basic understanding of how practice life was like. And so it definitely made it attractive for me to go into that same field. I thought the desire to help people and make them feel better about their smile was very cool and was be something that I would enjoy. And I was much more interested in that than anything else. And so I started at a very young age. I ended up becoming a dentist at 22 and orthodontist at 24. And so I've
Wow,
been practicing now for over 25 years. And so
that's
I'm
amazing.
pretty happy about all the wonderful smiles that I've been able to create. And giving people a sense of confidence is probably worth more than what the remuneration is. But that pride and that grace that I'm able to help people is worth it all. And that's why I keep doing it, and that's why I want to continue to keep doing it. I see the benefits for patients, and I help people every single day. So they either feel better about their smile, or I help them with their TMJ problems, get them out of pain, and that's very rewarding. So I've been blessed to have a long career, and I hope to have continued success in being able to help people.
I love it. Yeah, I think that's awesome. Starting with some really great mentors, of course, your own family and getting to kind of, follow in their footsteps and make a name for your own. And, it's a great way to get good sleep at night, doing the right thing and helping people. And so I love your whole mission behind what you're doing and how you're doing it, which is the most important part. In terms of the field of orthodontics, it's pretty vast. There's a lot going on. What would you say for your practice? What are your most popular services, and maybe what are some new technologies or services that are advancing smiles today?
I've been on the cutting edge of orthodontics since I graduated school, and every 3 to 5 years there's some new iteration of the same process to get people through from beginning to end in a easier way. Less pain, less discomfort, less time away taken from their life. And so nowadays we offer virtual exams, we offer virtual appointments. We have 3D digital based treatment plans where we can show the patient what their end result is going to look like before we ever start. And then we can create the brackets or the aligner system to be able to duplicate what it is we see in 3D. So we can actually show the patient what they're going to look like. And then along the way, we can show them how they're progressing. And with that process, that's also how we're able to do appointments virtually. And it's made it a lot easier for patients. It's made it a lot easier for us. We use a system called Grin, where the patient can actually send us images of their mouth. We give them a little scope that attaches to the back of their phone, and they can communicate to us if they have any concerns, or we can even do regular appointments that way to track how their teeth are moving. So then we either give them more aligners or bring them in for an appointment to adjust their braces. So digital technology has really helped us to improve our quality of care and the efficiency of the care. But then it's also given us more information. So we use ICAP machines, which are 3D X-ray machines, so we can visualize their airway and their joint. We can make diagnosis of how we're going to move their teeth in harmony with their function of their joint and their airway. Because we know that the airway begins to shrink after about the age 35. If we plan for that in advance, especially with our early treatments, we can create airways where people are not going to have problems as they get older. So preventative airway treatments, and in addition to treating adults who have airway problems, we can visualize those with a 3D image, and we can create a treatment plan to address that problem. So many times these patients are using like sleep apnea machines like
Yeah.
CPAPs, and they're really uncomfortable. And so we can do things orthodontically many times to prevent the need for CPAP or sleep devices.
That's amazing. I had no idea that technology has gotten that great, and especially now that you can see patients virtually. I'm sure that's such a huge game changer. And, oh, I'm so busy, and which is, everyone these days, but you have an option at least to be seen virtually, get what you kind of need at a base level done. That's really awesome.
I mean, I think incorporating 3D treatment plans has helped patients to be able to not only track their progress, but then be able to see what the result is going to be. And then for us, it helps us to plan their treatment time and to keep them on that path. And majority of the patients stay on the path, and sometimes they don't always follow what we say. So we have to kind of help veer them back onto the path. But at the end, everybody's happy and everybody's thankful for the result that they were able to achieve. Some people require surgery. Some people we have to
Yeah.
take out teeth, which is very rare. Some people we have to replace missing teeth. But sometimes the process is more involved than just getting, the teeth that they have straight, especially for the older generation.
Something you kind of alluded to a little bit earlier, and, talking about your approach with people and really loving helping people, improving smiles, improving their overall health. What else would you say is kind of unique about your approach? What is, unique about, your practice and the way you guys do things?
I'd like to say that we take a family type of an approach where we bring patients in and they become part of our family. We help them transition to, where they are, in their confidence level with their smile, and get them to a place to where they can feel really great about their smile. So I think that family approach becomes very personalized. So along the way, we celebrate certain milestones. At the end, we celebrate, with a little song and a little gift. We give them things like, all the candies and stuff that they weren't supposed to eat during the course of their treatment. And then, we do little fun things along the way every single month for our patients to try to get them, engaged and involved in the practice. And, rewards and promotions and things are always fun to get, friends and family members involved. So, I mean, the whole approach for me and for the team is always to try to do whatever we can to go above and beyond for the patients. We see the patients as our boss, that we take a team approach to how we're going to be treating everybody. And we want to treat everybody like as if they're our own family.
That's so awesome. I love that, especially the sweet treats. That's pretty funny.
I always make the joke and say they're donated by the dentist, but they're really actually given by us. Just because we keep telling them, oh, you can't eat that, you can't eat that. So at the end, we're like, here's some popcorn, here's some Snickers, here's some stuff that Skittles, that you really weren't supposed to eat.
Right.
And it's funny. And then so we do things along the way to make the process fun. It usually requires multiple visits. And, we want to be just as loved as from the first visit as the last visit.
That's like fun.
Our patients seem to like it. We seem to be growing over time, and we've had a lot of word of mouth, growth just because of the way that we treated people. And I've now had people come back, 10, 20 years later just to get a new retainer, or 50
Wow.
years later to have a touch up because they stopped wearing the retainer and didn't listen to my instructions or something. So yeah, I would say those are some unique, key features that make our practice a little different.
No, it sounds like fun. It sounds like an inviting place, a place that you want to go. It's not scary, which I think kind of leads into my next question. I think there's a lot of misconceptions about orthodontics. What you do, how you do it. Maybe there's some specific situations, questions that I'm sure you get all the time, or things that people are Googling and they're like, oh, I just Googled this, and this is what came up. What do you think about that? So, Dr. Google versus what's real. What would you say are some of the misconceptions that you're constantly debunking on a day-to-day basis?
I think the biggest one is that anybody could do orthodontics. That the dentist can do orthodontics, that a direct-to-consumer company can do orthodontics, that moving teeth is not complicated, and that it just requires using some aligners or some appliance.
Mm-hmm.
And I don't really find that to be true. I think that there's a reason why there's an orthodontic specialty and why we go to school for additional time. And I think it's because of the level of detail, that we put into the diagnosis and the treatment plan and what it is that we want to achieve at the end. Straight teeth is not just the goal. It would be straight teeth with a bite that works and fits together properly. And many times it does require shaping and contouring of the teeth so that the bite can fit together. Understanding how someone's going to be growing and how to expect or predict that type of growth is just really not something that a computer can do well. And it's really not something that direct to consumer companies do well, nor is it something that if we haven't had the proper training, that they're going to really have the insight into understanding all of the ins and outs and ups and downs that could potentially happen. So one of the things I've been seeing over the last several years is patients that have been treated by non-orthodontic specialists asking me to then complete their care. And let's say maybe 30% of the work was done, but they ended up collecting a full fee for that. So then my situation is challenging because then I have to then charge them a full fee to correct 70% of their problem.
Yeah.
And the person's very frustrated because now they had to pay twice, and where they should have just probably started with an orthodontic specialist like me or someone that is certified to to do that kind of work. To go to school 2 more years after becoming a dentist was not necessarily easy, but it was definitely very rewarding because it gave me those insights to understand the things that I had no idea about when I finished dental school. And as much continuing education as I could take, there's probably no way to get that consolidated, 2-3 year experience of additional training, which is what specialists have to go through.
For
So I would say that would be the biggest one. And I think that because some of these direct to consumer companies have failed in the last several years, it's also an indication that you can't just move teeth and say you're doing orthodontics. You have to really understand what's going on with the bite, what's going on with the airway, what's going on with not only how the teeth are looking inside the face, but then also how they function and fit together. So it's juggling a lot of parameters, and I don't think that someone that's untrained or not a specialist is probably the right person to do that kind of work.
Yeah, I've seen those commercials and I've seen those companies, and it always kind of wigged me out. I was like, I don't know how they can do all of that and it's right. You know what I mean? The right way. It's like, and just kind of how you said, it's just moving teeth, right? It's not just that. It can be all these other corrective issues that you have, making sure your bite is really great, airway issues as well, which I think a lot of people would not consider, and so yeah, and how they're growing, what if someone really young does that and, they're obviously a growing person. And so it might require, it will require some more finesse than, a really great retainer or whatever they're trying to do.
Yeah, I mean, it affects the way that someone, lives their life and interacts with people, and the way that they look and the way that they talk and they eat and they speak. And that is much more important than, like, let's say, the idea of just selling them a product. And so
Yeah.
I think that, what we're doing is we're doing a service, and that service has to come with understanding what's going on with the gums, going on with each individual tooth. Many times we have to coordinate with a dentist or another specialist to coordinate the treatment plan. People that have missing teeth, it's, orthodontists don't replace missing teeth. So I have to coordinate with their dentist to replace the missing teeth, whether it's going to be with an implant, whether it's going to be with a bridge. And many times, planning that in advance makes it so much easier for the correction for the patient, and they can get a much better result. If it's not planned out correctly, then some of the things I've seen are just related to kind of getting a couple teeth straight, and that really doesn't work for the patient's long-term reconstruction to get them back to where they really would be performing like as if they were in their teenagers again.
Mhm.
And then that's what we want. We want to try to maintain youthfulness for the people for as long as possible. And my friends sometimes joke around. They're like, "Well, you're not a real doctor," but reality of what I'm doing is very much just as involved as a medical doctor, because I'm taking into consideration everything that's going on in their head and neck related to their teeth and their smile and their bite. And so many times we're working with ENT specialists, we're working with maxillofacial surgeons,
Yep.
we're working with physicians, we're working with dentists, we're working with periodontists to coordinate the best results for the patient. And those other companies or single individuals are really not going to be able to coordinate all of that or provide that level of care. So multidisciplinary specialty work for complicated cases is definitely required. And when you don't have an orthodontic specialty, you're not going to be able to manage that, in my opinion.
Definite note. Definite note on that. Yeah, I mean, I really like your holistic approach and collaborative approach, especially with other people that might be involved. And I think that's really important for patient care. And speaking of patient care, my last question, which I kind of love asking, is, what I always say this is like the wish list. What do you think if you could give a tip or pro tip for any client of yours, anything that would put them in the right direction, anything that you wish that they would do, or anything that would just put them in so much better health or so much better care in the future? What do you think that would be?
Well, my pro tip for the interview would be that all patients that get orthodontic treatment have to wear their retainers for the rest of their life, that there's no giving up on the retainer. A retainer is like a toothbrush. It's a prevention device to prevent you from needing treatment for the future, just like a toothbrush is. Really important to wear your retainer every single night forever. Really important to brush your teeth twice a day so you don't have to visit the dentist as much. Really important to going to the dentist and having a cleaning done every 6 months. When in treatment, I always recommend people have cleanings done every 3 to 4 months. And these are things that help to maintain the overall level of dental health while we're in treatment. And it actually makes the treatment go faster and creates less pain and sensitivity for the patients. I think that another pro tip would be, do your research on who it is that you're working with, because it is a service. We are considered dental artists. So
Yeah.
if you don't like the way that the artwork looks, and when you look at the before and after pictures, then that may not be the artist of choice for you. So I think looking at people's before and after photos are important to really see how smiles will turn out, because making those decisions one way or the other has a big impact on how the smile turns out. It's really not just getting teeth straight. So that's my pro tips for that.
Awesome. I appreciate that. And for the folks that are out there that are watching that are in private practice, could you give a pro tip to those people that maybe are looking to start their own practice or in practice? What has been really awesome and helpful to you that you've carried throughout your career?
Patients don't really care how much I know, but they really want to know how much I care. And so I think, always putting the patients first is always the best choice, and making decisions related to putting their best interests over yours is the most ethical way of dealing with patients and successful way of managing a practice.
I love it. Thank you, David, for all your tips, your knowledge today, and the story behind how you started this amazing empire. Really appreciate your time and hope to have you on again.
Thank you.
Thank
My
you.
pleasure.